Researchers, who specialize in critical care medicine, have recently documented an unusual and unexplained trend taking place in Calgary's adult intensive care units, in both the number of patients who have a fever when they are admitted to the ICU and those who develop fever while on the unit.
Using some data from Calgary in the 4 adult ICUs between 2004 and 2009, we were able to show that the occurrence of fever decreased from the initial value of 50% of patients admitted to the ICU to 25% over a 5-year period. Over the last 10 years, there have been many research-informed changes in just the general practice within ICUs that may well have resulted in a decrease in the occurrence of fever. So examples would be decrease in the use of invasive devices that we used to use for measuring blood flow from the heart that could also measure temperature, or increased attention to giving antibiotics to people who might be infected, because we know the longer we wait, the worse they do. Similarly, an increased attention to preventing infections that patients might acquire in hospital through protocols. So those things led us to believe that it's perhaps decreasing.
No other jurisdictions in Canada or internationally have yet reported on similar declines in fever.
We were able to show through our study that a small portion of that decrease, so 5% of the total 25%, was a reflection of a change in the way we measure temperature. Whereas the bulk of that change, the 20% of the 25%, was unexplained. And so while it could be viewed as a good thing and that it could be a reflection of decreased infections, we actually showed that there's been no appreciable change in the occurrence of severe infections, so infections in the blood during that period of time.
Researchers plan to examine data beyond 2009 to find out what is happening with the incidence of fever today.
What we're now working on is trying to get answers to some of those hypotheses. And so, looking at whether there's been a shift in the way patients present with an infection from elevated temperature to now lower temperature, which we've well recognized for a long time is one of the criteria for diagnosing severe infection, actually is low temperature, and whether there's been a shift in the potency of the bacteria, going from bacteria that are more likely to create a fever to bacteria that are important and cause infections, but less likely to create that febrile response. So those are some of the things that we're working on in follow-up to that study, trying to really understand fever more before embarking on a larger study, again trying to answer the question of what do we do with fever in the ICU.